Good afternoon. Case counts from the coronavirus continue to rise nationally and in Pennsylvania as a whole. Here in Philadelphia, our daily case counts in the past week have been stable, neither rising nor falling. So here are the numbers with the background. In cases since yesterday, we've identified our new 91 cases, bringing us to a total of 26,901 since the beginning of the epidemic here in Philadelphia. Now, the past week, we've averaged just a little more than 110 cases per day. That's the week that ended last Saturday, which is no significant change from the week before that. There have been changes, however, in the age group of people who have been infected. In the last 4 weeks, our cases are rising in people under the age of 40, are pretty much stable in people between the ages of 40 and 49, and are falling in people over the age of 50. Now, people over 50 are the ones who are most likely to be severely ill, so it's good that the case counts in that age group are decreasing. But we're still concerned that the younger people who may not themselves get severely ill can pass it on to older people, so we're going to need to watch the age range of people getting infected in the future closely. Since this time yesterday, we've identified 0 new deaths from the coronavirus. Our total since the beginning of the epidemic is 1,617. Of which 832 or 51% are in nursing home residents. Now, so far, the last week, the week that ended last Saturday, there were only 4 deaths that we identified and 16 the week before. It's great to see those numbers as low as they are. There is a delay in reporting, so we do expect those numbers to rise a little bit. To put that in perspective, at the peak of the epidemic in mid-April, in 1 week, we had 246 deaths. So no death is acceptable. Every death is a tragedy. The fact that we're getting closer to 0 is a sign that we've made really a lot of progress so far in the epidemic. Now, other areas of the country are continuing to see very rapid growth of the epidemic. U.S. case counts are continuing to hit all-time highs, particularly severe in Florida and Arizona and Texas. In some cases, their daily case rates on a per capita basis are higher than they were in New York City at the peak of the epidemic in New York City. These are places that opened without enforcing safety precautions like masks. And I think they're paying the price for that. We're also seeing rapid growth in southwest Pennsylvania, the Pittsburgh area. In Allegheny County, they're now reporting more than 150 cases per day. That's up from about 20 cases per day 2 weeks ago. And every region of Pennsylvania is showing increases. We're also seeing rapid growth of the epidemic in Delaware, which has really seen nearly a doubling of the case rates in the past week. Now, we're not seeing that rapid increase here in Philadelphia yet. We want to keep it that way. That's why we responded as we have to try to prevent a second wave here. The things we're doing, just to remind you, include reminding businesses and activity managers of their responsibility to enforce everybody keeping a distance, and even more so, enforce everybody wearing masks. We can't be there, but other people are there who can enforce that. We do have an executive order requiring masks, and the governor has an executive order requiring masks. We will be launching a media campaign reminding everybody of the importance of masks on this Thursday. On Thursday, you'll hear more about that media campaign. We have put on pause the reopening of restaurants and bars to indoor dining here in Philadelphia. We are recommending that everyone who can work remotely continue to do so. And I would recommend that people avoid social events and going to restaurants and bars outside of Philadelphia where they are open for indoor dining. These are places where people are close together and they're not wearing masks. And to the extent that we can understand how this virus is being spread in other areas around us, that appears to be the case. It's these social events in restaurants and bars. Now, we know that we're not going to totally be able to eliminate this virus, and so we want to protect those people who are at most risk for severe infection. And so we are recommending that people who are medically vulnerable take extra precautions. And the basic idea here is stay home and try not to let COVID into the house. That means that other people who are in your household should also stay home as much as possible. And that when you're around those household members who are leaving the house, wear a mask and ask other people to do that as well. More information on everything I've discussed here, as well as our statistics, is at www.phila.gov/COVID. Thanks.
Good afternoon, everybody. Dr. Farley, can you talk a little bit about your level of comfort with kids returning to school by taking the bus, by limiting the numbers in classrooms? What is your comfort level on the kinds of things that we normally would think of with a return to school?
Well, we know in general that children are less likely to become ill with this infection. It's a little less clear the likelihood to spread it to others. And so we're probably, there's less concern there would be with children and getting together than with adults getting together. Nonetheless, in any place where we have children getting together, we're going to have to put in place a variety of safety precautions. And we are working with the school district around safety precautions in the classroom, in buses, and other settings. We don't have all that information. They haven't presented their plan yet, but I can tell you that their plan will be there to try to make the risk be as small as possible. It will never be zero risk, but we will try to minimize that risk.
The health department has issued some reports that indicate that increase in the cases is occurring in heavily populated Latino communities, such as those in Mayfair and Torresdale. And we see that the Latino community is particularly vulnerable in this case. What are your thoughts on it, and what measures are being to impede this, to prevent this?
So we have seen higher case rates in Latinos, higher case rates in African Americans and in whites. This has to do with longstanding disadvantage of those populations, and so we are making efforts to communicate to people about their risk. We are particularly around the section of workers. We're making efforts to increase testing availability in populations that are underserved, but it boils down to really encouraging people to use masks and keep their distance from people. And we are going to just continue to try to get that message out.
Yeah, this is for the health commissioners. So I just want to clarify that Delaware has been added as a recommendation to self-quarantine if you're coming from Delaware to the city. When did that go into effect? When did you add that state to your list? And what does that mean for people who live in Delaware and work in the city?
So, we set a numeric threshold for the states that we consider to be high incidence. And I was just notified yesterday that now Delaware has made that. I'm not sure if we've updated that on the website yet. So we recognize that there are practical concerns about that, practical issues around that. So we're going to look at that. At the moment, I'm not recommending that people who are commuters from Delaware go into quarantine for 14 days. But I do recommend that people be concerned about traveling high incidence areas within Delaware. And we'll look and see whether we need to make our recommendations, need to modify recommendations in view of the practical issues here.
So you are asking them if they're commuters to quarantine or not?
No, we're not recommending that right now.
Okay, for the commuters.
Correct.
For anyone though.
We are still have a recommendation that are people who travel from high incidence areas. Again, that includes states like Florida and Texas, where they have very, very high rates. Delaware has newly met our threshold. I'm just realizing as of today that this is going to cause some practical issues for commuters. And so at the moment, I'm not recommending that for commuters. And we'll look at whether we need to change our recommendations in view of that.
Dr. Farley, there seems to be growing agreement that the coronavirus may spread more widely than was previously thought through the air. How might this change the city's recommendations for all your guidelines, but especially for indoor gatherings and school?
Yeah, I've asked our experts what implications that would have. First, I should say that the feeling amongst our experts is if it travels through the air, it's not the most common way that it is spread. If this were really traveling widely through the air, as some other viruses do, and we would see cases, for example, where the infected person was in one room and the person who became infected was in another room, and they never really had any face-to-face contact. We don't see so much of that, so if it occurs, it's not very often. And the feeling of our experts is that it wouldn't really change our recommendations for how we operate the various businesses and activities that we allow to operate under our modified green phase. That if it were widely accepted that airborne transmission occurs, it might change what is done within hospitals. And it would be difficult to deal with that in hospitals because there are special rooms for handling a person who has an infection that is spread through the air. And there are only so many of those. So it may be more practical, have more practical implications there, but it probably would not change our recommendations outside of medical settings.
Got it. Thanks very much. And then, Brian, could you give us an update on the city's efforts to acquire PPE and also on the quarantine space leased by the city?
So when you talk about efforts to acquire PPE, do you have a specific question or just kind of general efforts?
Have any of the, there was a large order that the city was waiting on coming from overseas. Has that come in, or have other possibilities popped up in the meantime?
So if I if I recall the order you're referencing, it's been several weeks. So we did end up canceling an order that was to be shipped from China, which were N95 masks. We are pursuing other shipments of N95 masks into the city. I think we have a good supply of surgical masks at this point, and the surgical gowns don't seem to be as much of a pain point at this point.
And then also, what is the occupancy of the various quarantine spaces that the city?
Sure. So our occupancy at the COVID prevention site, which is on 12th Street, is nearly full. Those are individuals who had come out of congregate care facilities, and we're currently pursuing additional space for that activity. I believe I have to use specific numbers on the quarantine and isolation space. I believe it is around 50% occupied, but we'll confirm and get you those numbers back.
Thanks very much. That's all I have.
Sorry, Sean, can I go back on the PPE just to clarify one point?
Sure.
And the hospitals in the city, for the most part, purchase their PPE directly through manufacturers. It's not coming through the city. And I spoke to the chief medical officers on this last week. And all the hospitals at the moment are very well stocked as far as their N95 masks. That was not the situation earlier in the epidemic. And so right now, if anything, they're trying to stockpile in case we get a second wave. At the moment, they're doing fine. Particular car as a way to reduce the risk of transmission.
And my last question is for the commissioner and the mayor. We covered an incident in Old City where a gun was pulled over the weekend. Some parties in that situation said, hey, that had to do with an incident over social distancing. You guys may remember the incident at DeBruno Brothers a couple of weeks ago with someone spitting. Again, we've been seeing an escalating number of confrontations over health. Obviously, it's something top of mind for many of the residents of the city. Is there advice for how we kind of navigate through these very real fears and tensions among citizens?
Doc, you want to start?
Let me just say, I don't know that necessarily these are escalating. I think that these kind of sort of arguments happen and confrontations happen. In general, the majority of people are wearing masks. That number we hope is increasing, and we think it can increase. It's going to take some time for people to adjust to it. So you may see some incidents like that. I think we can get there through a combination of the policies we're making and the encouragement we're making. And individual confrontations are going to have to be dealt with as they always are.
So you mentioned, I think this question is for Height. I was wondering if there's a concern about children transmitting the virus to others in their household. Commissioner Tom Farley, I know you mentioned that you were encouraging people in more vulnerable populations to kind of be aware of who's entering and leaving their household. Is that also a concern for children?
Dr. Farley? Yeah, I mean, that is a concern for children. If we have evidence of there being spread in a school or children are likely to get infected, they could bring it back to people at home. And if you have elderly people or people who are medically vulnerable at home, that's a risk. So we're doing everything we can to communicate to the vulnerable people in those households that they need to take precautions within those households. That's not a risk that we can eliminate, but it's a risk we can reduce as much as possible.
Hi, I have two questions for Dr. Farley. My first one is, what are case numbers and trends telling you? And are we getting further away from reopening the final businesses that remain closed as compared to, say, a few weeks ago?
Well, our case numbers are showing that we are not decreasing or not increasing in the last week or so. Now, before that, we had been decreasing, so the fact that we are no longer decreasing is not a good sign. On the other hand, we're not increasing like the areas around us or increasing rapidly like the southern parts. I think in view of the increases all around us that we need to be very cautious right now. I wouldn't necessarily say that we're farther away, but I'm in no hurry to open up restaurants for indoor dining, which appear to be an important site for transmission elsewhere.
Okay, and have your benchmarks for reopening indoor dining at restaurants or those other businesses with indoor sort of congregate settings, have those benchmarks changed in recent weeks?
We haven't updated our targets for that. I think we need to rethink that. We haven't met those targets for one thing, and I'm not sure that whether we need to meet those targets at open indoor dining. I think that the larger context is concerning me as much as the fact that we haven't met those targets. That is to seeing increases everywhere else where they have reopened. And I think, again, it's the particular concern we have about indoor dining where people are getting close together and they're not wearing masks because they can't wear a mask while you're eating, that setting is particularly risky.
Dr. Farley, with my greetings to the mayor. My question has to deal with a chart that's been issued by the Texas Medical Association in regards to activities and the degree of risk. And my question is, what is the message that the city has for the people in regards to this chart for safe activities?
I have not seen the chart. I would simply say that we consider activities that are indoors to be more risky than those that are outdoors. We consider activities where people are wearing masks to be at greater risk than where they're, where they're not wearing masks to be greater risk than if they're wearing masks. And then the larger number of people to be greater risk than a smaller number of people. And people are close to each other, greater risk than those if their people are more spaced out. And so we use those sorts of criteria in determining what activities we are more concerned about and more hesitant to allow to restart.
Just one question for Dr. Farley. Is there a target turnaround time for test results at the city-run site or the city health department sites?
The greatest delay in turnaround really depends on what laboratory it's sent to. So that those that are sent to our laboratory and hospital laboratories may have a turnaround of 24 hours or so, and those that are going to the national laboratories more like 48 hours and sometimes longer. The shorter the better. We would love to have less than 24 hours because then that helps us to do contact tracing sooner.
And I'm asking because some readers have been telling us that their results are taking a week or longer, and then that's stop gumming up other plans and things for work or other types of things. Is there a way to tell which lab it's going to, or is there anything they can do?
We can look at our statistics. I have not heard of taking that long to have test results. Now, I have heard that some of the national laboratories were bottlenecked because of the huge demand from the southern states, the western states. So maybe there's some that has happened recently that I'm not aware of, but our average turnaround and for the national labs in the past has been 1 to 2 days. So it would be very unusual to have that many. And certainly 7 days is far too long for what it ought to be.
Okay, thank you.
All right, you're all set, Danya? Very good. And this is